Welcome to the lecture on epidemiology by Dr. Asmita Bansod from GNP Sir classes. Epidemiology is the study of disease in a population and factors that determine the occurrence of the disease. John Snow is considered to be the father of epidemiology. The two broad types of epidemiology are 1. Descriptive epidemiology, T, P, time, place, and person distribution. 2. Analytical epidemiology, why and how. The picture shows the epidemiological triad. The host is at one end, and the agents and environment are at other two ends of the triad, and the determinants of the disease are within the triad. Thus, the host will be affected by the disease depending on the agent and environment. Based on the spread of the disease, different names have been given to diseases, which are as follows: sporadic, irregular or scattered, endemic, constantly present in a population, epidemic, excess than the expected level, and pandemic, involving multiple nations. The epidemic curve is a graph of the time distribution of cases. The period of accrescence, or ascending phase, is the initial phase where the number of new cases of the disease starts to increase. The culmination point, peak or acme, is the point at which the number of new cases reaches its highest, and lastly the period of decrescence, or descending phase, is the phase where the number of new cases starts to decline. It indicates that the outbreak is coming under control, either due to natural factors, like herd immunity, or effective interventions, like vaccination campaigns or public health measures. This is a helpful breakdown of the differences between rate, proportion, and ratio. Let's summarize and clarify each term with examples. 1. Rate, definition, measures how frequently an event occurs in a defined population over a specific period of time. Key features: numerator, number of events, e.g., number of deaths, number of disease cases; denominator, population at risk during a specific time period, time, explicitly included in the denominator, e.g., per year, per 100,000 people per month. Proportion, definition, a type of ratio where the numerator is a part of the denominator. It expresses the fraction of a population that has a specific characteristic or condition. Key features: numerator, number of individuals with the characteristic or condition. Denominator, total number of individuals in the population, expressed as a fraction, e.g., 0.25, a decimal, e.g., 25%, or a percentage. Ratio, definition, a comparison of two quantities. The numerator and denominator can be independent of each other. Key features: numerator, one quantity; denominator, another quantity, expressed as a fraction, e.g., 1/2, a colon, e.g., 1:2, or x to y, e.g., 1:2. Morbidity, mortality, prevalence, and incidence are key concepts in epidemiology that help us understand the impact of diseases on populations. Here's a brief definition of each term. Morbidity refers to the state of being ill or having a disease or a medical condition. It describes the burden of disease in a population. Mortality refers to death. In the context of a disease, it refers to the number of deaths caused by that disease in a population. Prevalence is the proportion of a population that has a specific disease at a given time. It measures the total number of cases of a disease in a population, both new and old. Incidence is the number of new cases of a disease that occur in a population over a specific period. It measures the risk of developing a disease in a population. Attack rate, when a population under certain circumstances may be at risk of a disease for a limited period of time only, then incidence is generally called as attack rate. Secondary attack rate, number of cases of a disease during a specified time, incubation period, following the occurrence of first, primary case, within a closed group who are at risk. Case fatality, number of deaths from a disease to the number of cases of same disease. Here are some other definitions. Propagated epidemic. Epidemic continues for more than one incubation period. Point source epidemic, occur in single incubation period. Yield, amount of previously unrecognized disease that is diagnosed as a result of screening effect. Specificity of a screening test is the ability to correctly identify true negative. Sensitivity of a screening test is the ability to correctly identify true positive. Lead time, time between first possible point of detection and usual time of diagnosis. Serial interval, time between onset of primary and secondary ES. Generation time, time between receipt of infection and maximum infectivity. Latent period, time between disease initiation and detection. Iceberg phenomenon, submerged portion represents inapparent cases and physician sees only tip of iceberg. The methods of epidemiological studies include the cohort study, case control study, cross-sectional study, ecological study, and the RCT. Each of the technique is explained in detail in the above table. Now let's understand what is a survey. Survey is the data-gathering non-experimental investigation conducted mostly under field condition on target population. Two types. Cross-sectional conducted only once at a particular time. Longitudinal conducted repeatedly. Screening, diagnostic survey, mass screening, total population. Strategic screening, diseased population. Perspective screening, early pathogenesis stage. Surveillance is a continuous investigation of a given population to detect the occurrence of a disease for control purpose which may involve testing of part of population. Monitoring. It is routine collection of information in disease productivity and other characteristics possibly related to them in population. Now we discuss zoonoses. Zoonosis is an infectious disease that is transmitted between species from animals to humans, or from humans to animals. Zoonotic pathogens can be bacterial, viral, parasitic, or fungal, and can spread to humans through direct contact or through food, water, or the environment. Zoonoses can be classified based on the etiological factor, for example bacteria, virus, fungi, parasite. It can also be classified based on the reservoir host into a anthropozoonosis disease transmitted from lower vertebrates to humans. Primarily affects animals. Example rabies, brucellosis, Q fever, leptospirosis, ringworm. B. Zooanthroposis, reverse zoonotic transmission, disease transmitted from humans to lower vertebrates. Primary of human origin. Example MRSA, Cryptosporium pavrum, Ascaris lumbricoides. Circa amphixnosis, maintained in both humans and lower vertebrates. Transmitted in either direction, e.g., E. coli, Staphylococcus, Salmonellosis. 3 classification based on the transmission cycle. This can be a direct zoonosis, perpetuated by single vertebrate species. Example anthrax, rabies, Q fever. B. Cyclozoonosis, 2 or more vertebrate to complete transmission cycle. Obligatory, involvement of human host necessary. Example taniasis. Non-obligatory, humans accidentally involved in life cycle. E.g., hydatidosis. Circa, metazoonosis, requires both vertebrate and invertebrate host to continue life cycle. The examples of the diseases are shown. D. Suprazoonosis, requires inanimate objects to complete the transmission cycle. This can be of different types. I. Saproanthropozoonosis, disease transmitted from animals to humans through inanimate substances. Example Erelicepaloids. 2. Saproamphixnosis, humans to animals through inanimate objects. Example histoplasmosis. And 3. Saprometanthropozoonosis, requires vertebrate, invertebrate, inanimate object. Example, fasciolosis. A. Transovarian, tick-borne encephalitis. Next is vector-borne zoonoses. 1. Developmental, only development of causative agent takes place. Example Dirofilaria immitis in mosquitoes. 2. Propagative, only multiplication of causative agent takes place. Example plague and yellow fever. 3. Cyclopropagative, both development and multiplication of causative agent takes place. Example Trypanosoma cruzi in bugs. The table shows some zoonotic diseases, their host, and the symptoms. In this table, and the subsequent tables, the important zoonotic diseases are mentioned. This table shows some zoonotic diseases with the causative agent and the disease they cause. This table shows some zoonotic diseases with the causative agent and the disease they cause. This table shows some zoonotic diseases with the causative agent and the disease they cause. The table explains the biosafety levels 1 to 4. Thanks for watching. Share, like, and subscribe GNP Sir official channel. See you again. Bye.